Dental veneers is something that a lot of people get excited about. We have patients asking all the time, kind of to take them through the process. What are veneers? How do they work? And what kind of results are possible? Dental veneers are either composite or plastic materials or thin porcelain materials that are placed kind of over one or two surfaces of the front teeth in order to create a better shape and color to help land in a smile that a patient really wants. Dental veneers range in terms of how they're done. We have veneers that are no prep veneers, which essentially means they're little pieces of ceramic that are glued on top of your existing teeth without making any changes to your existing smile. Most dental veneers require a small amount of preparation or grinding to your existing teeth, and some dental veneers can be done chairside, which means your dentist will use bonding or filling materials in order to reshape or color the teeth right there in the dental chair. There are some differences between kind of these products and how they land in your mouth and the process, and also differences kind of in the results. Composite or chairside veneers are a quicker solution. They can be done kind of in one day, generally less expensive than porcelain veneers, but the lifespan sometimes is not as great in terms of how long they look great. Composite materials tend to dull over time and lose a little bit of their luster and their shine, and sometimes can pick up small amounts of stain or discoloration the longer they're in your mouth. Porcelain veneers, on the other hand, are certainly more strong, but they do require usually some small grinding or shaping of the teeth prior to placing them. This type of veneer is a non-reversible procedure, meaning once you commit to having veneers, you're basically committed to having them forever. There's no way to take them off and not put veneers back on. And some patients are unaware that veneers sometimes are not lifetime investments. Veneers can chip and crack, they can discolor and stain, and they can require replacement. And certainly different materials and different dentists achieve different things. But my general foundation for patients is if you're going to get veneers, expect to replace them at some point. And if you're not comfortable with that scenario, then maybe veneers aren't for you. The other thing to consider with veneers is something called no prep veneers, which is essentially thin pieces of porcelain that are glued to the outside of the tooth. And this is a much more conservative approach. These tend to be expensive because we still have to manufacture them in the lab, but it allows us to achieve something that we can pop off and then live without if we had to. There is a trade-off for no prep veneers. We can't create quite the same contours that we can create when we smooth or shape the teeth beforehand. So we give up a little in terms of the aesthetic outcome sometimes. Some patients, depending on the position of their teeth and the smile that they want, are great candidates for veneers that don't involve any grinding prior to placement. So it really just depends on what the condition of your mouth is, what the results that you are hoping for are, and those types of things. So, the common theme here is to ask questions of your dentist. But I'll say it again, if veneers is something that you're considering, make sure that you have a conversation with your dentist. Ask them about the difference between composite or chairside veneers, porcelain veneers, and no prep porcelain veneers. Ask whether you'd be a candidate for any or all of those, and kind of have a discussion about what the expectations in terms of results are. Veneers can be a wonderful way to make over a smile and kind of create a look that many people want, which is a really uniform and bright smile. And it can be done pretty easily too. So if you're interested in that, reach out to your dentist and we'd be happy to help you.